Intramuscular injection. Intramuscular injection is defined as introduction of medicine into the muscle in form of solution. This allows the medication to be absorbed into the bloodstream quickly. Purpose: to obtain a quick effective medicine than it is obtained by oral administration and subcutaneous administration. Assures that the total dosage will be administered and the same will be absorbed for the systemic action of the drug. The medicines that is not suitable for intravenous administration because some drugs are irritating to veins. Principle: the knowledge of the anatomy and physiology of the body is essential for the safe administration of the injection. Injections are means of introducing infection into the body, if carelessly given. Drugs that change the chemical composition of the blood will endanger the life of the patient, if not used cautiously. Any unfamiliar situation produces anxiety. Once a drug is injected, it is irretrievable. Antidote may be available for particular medications, but the best antidote is prevention. Organization and planning results in the economy of time, material, and effort. General instructions: give injections only on the doctor's written orders. Follow strict aseptic techniques. Syringes and needles used for injections should be kept separate from those used for other purpose. Always have the syringe and needles in good order. Change the needle after withdrawing the drug from a rubber-stopped container before giving injection to the patient. Observe the 5 rights of the administration of medicines. Never use a drug whose expiry date is over. Always have a patient relaxed and placed in a comfortable position. Never allow the patient to walk soon after the injection. Select the appropriate site for giving injections. Rotate the site for patients getting insulin to prevent lip dystrophy. Use correct technique of injection, the needle inserted gently and quickly, and the drug injected slowly. After inserting the needle, always withdraw the piston to make sure that it is not in a blood vessel in case of intramuscular and subcutaneous injections. Solution for injection should be clear, sterile, nearly neutral in reaction. Massage the area at the site of injection except in case of intradermal injections. Injection should be charted immediately. Site of intramuscular injections. Deltoid muscle of the arm. The deltoid muscle is the site most typically used for vaccines. However, this site is not common for self-injection because its small muscle mass limits the volume of medication that can be injected, typically no more than 1 milliliter. To locate this site, feel for the bone, acromion process, that's located at the top of your upper arm. The correct area to give the injection is 2 finger widths below the acromion process. At the bottom of the 2 fingers will be an upside-down triangle. Give the injection in the center of the triangle. Vastus lateralis muscle of the thigh. The thigh may be used when the other sites are not available or if you need to administer the medication on your own. Divide the upper thigh into 3 equal parts. Locate the middle of these 3 sections. The injection should go into the outer top portion of this section. Ventrogluteal muscle of the hip. The ventrogluteal muscle is the safest site for adults and children older than 7 months. It's deep and not close to any major blood vessels or nerves. Place the heel of your hand on the hip of the person receiving the injection, with your fingers pointing toward their head. Position your fingers so your thumb points toward their groin and you feel the pelvis under your pinky finger. Spread your index and middle fingers in a slight V shape, and inject the needle into the middle of that V. Dorsogluteal muscles of the buttocks. The dorsogluteal muscle of the buttocks was the site most commonly selected by healthcare professionals for many years. However, due to the potential for injury to the sciatic nerve, the ventrogluteal muscle is most often used instead. Methods of intramuscular injection administration. Air-lock method. Expel the air from the syringe leaving 0.2 milliliters. Stretch the skin lightly with the index finger. Insert the full needle quickly into the muscle. Withdraw the piston to confirm that the needle is not in the blood vessel. Push the piston gently to give the medicine very slowly. Z-tract method. Expel the air from the syringe. Displace the skin laterally using the side of your left hand. Insert the needle, aspirate the placement, inject the medicine very slowly, marinating tissue displacement. Wait for 10 seconds to allow the medicine to disperse. Withdraw the needle, allowing the displaced tissue to return to its normal position. Nurse's responsibility. Check. The diagnosis and age of the patient. The purpose of injection. The doctor's order. The patient details. The nurse's record about previous. The allergic reactions. The necessity for giving test dose. The levels of consciousness and follow instructions. The site of injection. The patient's previous experiences. Equipment. A tray containing syringe and needles of various size, sterile. Transfer forceps in a jar containing antiseptic solution. Sterile cotton swabs and gauze pieces in sterile container. Methylated spirit in a container. Bowl with water. Kidney tray and paper bag. Drug order sheet. Water for injection. File to cut upon the ampoules. Small covered tray, sterile, to carry the prepared injection to the bedside. Preparation of the patient and environment. Identify the patient correctly. Explain the procedure to the patient. Provide privacy. Keep the patient's attention away from the injection by friendly conversation. Place the patient in a comfortable and relaxed position. Select a site suitable for the route of administration. Procedure. Select the medication. Hand wash. Prepare the medication. Keep the syringe with medications in the sterile tray and cover it. Make sure that the medicine taken right and correct dosage. Carry medication to the patient in a sterile tray. Identify the right patient. Prepare the site of injection. Inject the medicine by correct technique is essential for the safety of the injection. Spread the tissue between the thumb and forefingers to make the skin taut. Needle is inserted at a 90-degree angle, holding the syringe back the piston with the left hand. Using a steady push on the needle and aspirate by pulling back the piston with left hand. If no blood comes, gives the medication slowly by pushing the piston. Remove the needle quickly and massage the site for quick absorption of the drug. Aftercare. Inspect the area for bleeding. Help the patient to dress up. Ask the patient to take rest for 15 minutes. Check the limb movement to confirm there is no nerve injury. Watch for the signs and symptoms of allergic reaction. Replace the equipment in the proper place. Hand wash. Record the procedure on the nurse's record. Thanks for watching this video. Any questions, comment below. Thank you all. If you like this video, like, comment and share to all. Thank you.